Hello, and welcome to the Mpr International School. We will start the meeting. We will start now the meeting presentation of our school all around the world. Today it takes place for the people who are English speaking, and that will be a good time to know our school, understand how we do all around the world. Welcome to our radio here, and we will start the transmission now. We will start to explain what is NPR, or what is NPR. Is a new focus in the sciences. Means the holistic approach between the medical sciences. Welcome to the Mpr family. And the first I will share to you is a video. It's all around the world. Is in America, is in Europe, and also in Asia. Different countries, different medical sciences work together to treat patients in an interdisciplinary approach. We see here, you can see the all around the world. We have different places that when we teach the theory of our school is an online theory. Like now, you can see how we can the presentations in PowerPoint videos, so our students can make a pass and they are the online theory like this in our international room with a virtual classroom. In the video, our family is all around the world. Our family is in America. This is part of Visio of Nocio in America. This is part in Italy. This is in Argentina, in Chile, in Switzerland. In India, we have places in Oman, in Qatar, in Australia, all around the world in our school. And the video today is just to make a presentation of our philosophy, the philosophy of NPR. This is the objective. Walking to a new future and just share knowledge can teach others to participate in our school. This is the case of Einstein that he said many years ago. The mind is like a parachute. It works if it is not open. Very nice phrase. Very nice phrase, because to be in PR you have to be the mind open. There's a different point of view, is a different point of view how the patients how to do the diagnosis. Another phrase normally said in all my teachings. I want to present myself. I'm Professor Dr. Dario Di Rosa. I am the director of the International School. Now review our philosophy. And many years ago, this phrase was from a psychologist. The psychologist called it flow. And this phrase was, it is tempting. If there is a hammer to everything as if it's a needle. Why I'm saying this phrase? Why sharing that? Why? Because it is pattern of the super specialization Normally, when we see patients in our point of view only, we have one tool, the tool of our specialty. And that's why I put in my teaching this phrase. MPR in the paradigm. That's very difficult thing to change paradigm. We take the diagnosis target from to global, from to holistic, more disciplinary, and we get people to speak the same language, and therapeutic language. This way, with the patients, with an, you will see how. Show you the structure. Our courses are divided in the clinical posturology, the clinical posturometry. We learn the biochemical balance of the body, very important thing. We study the TMJs and the neuromuscular diagnosis. That means stomatologic systems. We study the dental occlusion. We will study the bio of the term, because it's very important. One, what is the type, and we say this is heart of the deprogramming and reprogramming. You will see in the presentation why I am saying that. And of the teaching online, we will share a general review, and then we will go to the practice. I have 30 classes online in this virtual room, as you know. Then this also a range of the classes just to listen in your classes. And also you will receive a PDF in a special box for you. And then we finish the basic course. We have this course, but to the master, we have to be from naked, the basic MPR, and then we test one for meditation people is postural osteopathic manual therapies of the MPR, and then functional and postural orthopedics advantage just for dentists. We will make during this encourage just to see how is the knowledge, and the participants can share your patients and diagnose together. Okay, we will start to say what is MPR. What is MPR now? Okay, what is MPR? Connection between the body, so facial system, and tone system. Balancing both of them, that will have a good balance in the body. What is the diagnosis? That's diagnosis and therapeutic method. It's not a technique. Both use tools of the whole medicine and make the balance into the automatic system and the post system. Also, do it of this. That's very important in medicine. And we found the integration what neurophysiological integration of all of the body. This is why we call Mpr rehabilitation. Integrate any technique that this arthritic work in Mpr. The key work together. We cannot absolutely do nothing alone. And we can do absolutely nothing only with speciality. We can make the patient only with one speciality. Important. The most important thing is we teach the people to the sciences to define the language between every discipline. If we talk the same language, we cannot work together. That is the real truth. Look at that point of view. Who have the truth? Both. Because if you see one patient in one side, the right man is 9, for the man is 6. And they can be there talking. Will arrive and again, because they are looking the number in the point of view. That happens normally in medicine, in medical institutes. And that's very, very wrong thing. One question, who has in your professional life therapeutic failure? Please try to of this very simple. Every word has a failure. But we are why that thing. We never ask why we in our treatment. If something don't go well, you repeat the trauma, you repair the trauma like this. If you have meditation like a physio or like an osteopath, you change. If one doesn't work, you change for another one. And their whole life like this, because it is not the technique that is work, our approach in front of the patient who is this meeting. Why I'm telling that? We win a Ferrari. We can buy a Ferrari. We are millionaire and we can buy a Ferrari. That's very nice car. Very, very nice car. And to repair a mechanic to do for this car, please put the car in the condition. And we back with the wheels, with the tension in one part, in one side, is not good. Coming back to the mechanic, and we said to him, no, to him, what do the job, and look at what happened. With the question, the kind of wheels we put. And we put there. It's to feel a stone. And every time, that's the same thing. I am very, very sure that will not that many to our our car. Using techniques because they do not work, make him think that they don't. Because no, we don't go the problem. And we can ask why something happened. When we have to do treatment, when is the priority? That's very, very important in medicine. And this technique is the last thing. If we do two things before, the technique will be perfect. Who can patient like this? Look at it. I will show the anticipation. If you start that who it has like a shorter arm. Yes, it is a shorter arm. But if you put holes in the mouth, they grow magically. Why? Because we are annulating the of the stomatognatic system. That's why we said in Mpr we have to balance the stomatognatic system and the rest of the body. But not only. Look, going through, and we see this patient with postural disease, with problem oculomotor system, problems in the teeth and the facial system. The question is how we treat it. In this, if we see things like this, problems in the stomatognatic system, but also custom body and with neurological integration. Their neurological integration. And the patient have a real short leg. How we can do that? If orthodrelipsis braces in the teeth who really treat them is because dentists look at the body. They look. If we have to treat these patients, we have to treat them integrally. If a patient like this who have a postural disease, a postural disease, but a real scoliosis, we should have a special approach. If we have like this, child with back, we don't after the posture, we do a real treatment. They have to see the whole body. The whole body is important to see, just not one part. We have to ice the foot supports, the knees, the position of the body. Look at that, like the actually for the mouth is making problem in the muscle change. And look at if we see ocular system before, have to see all these things to do an integration of diagonal. diagnosis, and then we can plan in a good treatment. If we early in child, we prevent in the future. Like this may be starting problem at the age of the gen I saw before, and the posture alteration. Even terms of system, teeth, and this one for the feet also understand when teeth is not working because you see with the AR you have tools to work for that. Look at that. Torsion, asymmetrical face, the postmetry. That's a very important thing. How we the patient, how is it? But here, if you see here, all the patients I'm showing you, there are problems, also system problems, and problems. A lot of patients, they have this problem. This I am showing you now is very, very important thing. Normally, I show that in my lectures because this patient did a lot of surgeries. He started with the pain and on the lumbar pain, and then carry on, and they do an surgery, upper surgeries, and never the surgeon looks and the body. That's terrible. And here also, I can show you a lot of patients like this, a lot of patients like this. Look at them. All teeth, posture, foot, body, teeth, but all of these patients, they have a lot of problems, and we cannot treat only with one specialty or one way. That is Mpr rehabilitation, 360 degrees for every patient. Younger patients, patients, I can show you a lot of patients like this. Look at that. Adults, other problem, all connected with the tonic system. And if we go into this back, and we we are better to cure the neurological integration. It's a big question, but very simple. It's no. Science is not ready because see in one point of view patients, and that's no right. Sure. Do this patients, if we have with the populations, family, and if we are dentists, we put everybody. It's not good. This is one thing. All of these patients I showed you before, more or less follow the same path. All of them. This is Adam Rose, but the names can be any name who go through a lot of specialists, a lot of specialists, and he finished like, with the same pain and a specialist looking each other saying, what happened? And the patient suffer and suffer. Everything we see that. These things we see patients that at the end, like psychiatric patients. Why? Because every one of us look in one view, in the point of view of our specialization. But if we take it out, we take things out, all of them out, is a unit. Therefore, is indivisible. I cannot see, I cannot listen. That's very, very, very bad. Maybe science sees the point of the iceberg. Icebergs, the biggest part of the iceberg is under the water. And this is the chaos, the root. The point is the somatic treatment. We compart, we integrate body and cranial system. That's the goal to the patient. But that don't mean that we need super specialization. But super specialization in or with interdisciplinary vision. Look at that, not new. These things are not new. This professor, who is professor, was an Italian teacher that in the 1936 put comparison stomach system and body and vision and postural disease. Very, 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 very ancient thing. And as you see here, new. But the thing is, the medical sciences, they have a more common sense. And we are looking for tools, techniques, machines, and that is not correct. A triangle is a triangle with mind, structure, and biochemistry. This is body equilibrium. It's a structure only, and we treat as one part of the structure. That's why things was born MPR and the integrated interdisciplinary protocol. Two things together. What means integrated interdisciplinary protocol? Why we said that? We said that because it's an active protocol that is adapting the patient. All specialists intervene the same diagnostic and therapeutic approach. And working different disciplines of medical science together. Doctors, physios, osteopaths, etc., etc. MPR is myofunctional and pleural rehabilitation. That is the name of MPR, the method. And why said that? We said that because it's myofunctional. It is doing a physiological musculoskeletal balance. It's because it's doing rehabilitation of the autonomic system with the body. And it's rehabilitation because put in balance all systems. Philosophy of MPR. Philosophy of MPR is very simple. The philosophy of MPR is like this. Imagine the brain like a computer. The more we have, the more ancient computer. The brain. We know because the guys know very, very well that if you have a hacker infect the computer, right, that is absolutely you need help. And we cannot put software. We cannot put a new software because it doesn't work. The computer is infected. We need to find antivirus, any antivirus, who protects the computer. The computer has sensorial information. It is into the brain. Even if it is wrong, even wrong, all information is arriving. And the of the computer information is wrong. The answer could be wrong. That's the protocol of Mpr is basically to deepen the systems. And this virus, we put them to sensorial deprogramming, who put the antivirus in, allow us to do the functional balance, and then we will reprogram if it is necessary. And with that, you will learn the tools to do that. Diagnosis, like any medical protocol, clinical diagnosis, diagnosis, supplementary analysis, what they mean. We study the oculomotor systems, we study the postural analysis, we study the stomatognatic system analysis, and the support analysis. With dental analysis, the posturometry and the stylometry. That means we measure. We do clinical diagnosis. Study also the supplementary analysis. That means food intolerances and amino acid deficiency. We are studying now the biochemistry, very important, the biochemistry, because we cannot do rehabilitation, a good rehabilitation, if the an intoxication. The thing will do not work. And the sensory deprogramming, we have different tools. We have special perceptive magnetic fields for the oculomotor system. Stomatognatic system, we have two things. One is growth and the other adults. In growth is an orthopedic treatment. That's for making dentists. For Altus is a special tool for body equilibrium device. This is a tool who all physio can use to do a programmation of this magnetic system. And you will learn that in basic course. For the support, we do magnetic therapy and especially insoles. So that tools, we do deprogramming of the different of the food support. And for biochemistry, we do special detoxification with natural medicine. And we can do that. And for the system, we do exercises, sensorial exercises. And you will learn that in the course also to teach. Programming the systems, we have for the stomatognatic system in child orthopedics, adults is a tool to recommend the position. Food support special results, and you will learn how to do that in the basic course. And for we do some to and for the gut balance. The occlusal postural alteration syndrome, that we have classification with the diagnosis, depends that they are also ambiochemistry, and this basic protocol of AR. We divide in dysfunction and dysmorphism. We therapy in the shock therapy and healing therapy. Healing therapy is deprogramming, balancing, and reprogramming. This is the basics of AR. We go into finding the cause, the symptoms of the, not the symptoms, the root of the problem. Patients of ages can be treated. Normal start early with the patient. We treat patients all age. And we address trace. Natural forces within us are the true healers of this holistic approach that we have to be all together to treat the neuromuscular skeletal disease. Possibilities of MPR are a lot of possibilities. Of course, they can do interest of the health sciences. In teams. What they can do rehabilitation in balance with the body, preventing failures. But most than in growth age, harmonic growth with the orthopedics and orthodox myofunctional postural treatments in balance with the body. We have a lot of things in body in equilibrium during the growth. Physiotherapists and orthopedists them for physiological rehabilitation. That means people who don't back every to return. They do anesthesia or test that do not interfere with our systems. We can understand each other if we can't understand each other if we don't speak the same language. That's very important. If every one of us and the other. An international network all around the world formatted with NPR. All around the world, we are connected in a big network, work together, and you will see the same formatting. We international teams who speak the same language, the same language together. We can and do treatment like this in dentistry, for example. We can dentistry like this fact. The important thing, the body balance. Look at that. Right after the treatment, balance. Only teeth. We get the rehabilitation in dentistry, and you told you before. But the most important thing is body balance. we can treat patients with chronic pain who then rows going around the whole specialties. We treat them with a good balance. Look at that, before and after. With them, we can patients all ages, like this, who has also teeth problem, with oculomotor system problem, who have biochemistry problems, intolerances, who have things we treat together at the end. This is perfect. We can age, and we can follow patients the growth, like this child, between 6 until this age. And we treat them with physical treatments, but not only doing that in the mouth, but in the whole body together, physios, osteopaths, and dentists. We get this balance, and that is very important. And then the team of Argentina, with the patient, shared that patient. That was a chronic patient who was cerebral for years taking medicine, but without working, can live with this postural alteration. And for doctor, physio, an osteopath, a dentist, 3 patients, keep running and rebalancing, and see the effect. You will see the effect of patient before and after. How it changes along the therapy. And the past changes suffering, now is not suffering anymore. And I did that. Patients of all ages, as shown you before, sharps, adults, this is MPR. MPR is treat together and the patient with a smile. Look at that MPR in action. This is MPR. This is the system who allows us to do a diagnosis, a common diagnosis, very simple and physiological treatment. Hypothesis, the primum no harm. And that. Saint of our church, Catholic, was many years ago. He said, start by doing what's necessary. That means priority. Do is possible, and finally, you are possible. This is the This is the we started in July, and this is the class you can start and you can do. This in July. We are inviting you. This is online theory, and we will do in Oman and in India also. If we have people in there to track there, one in Oman and one in India, depending on the you to our international meeting that we have in Italy in September. If you like to come and you can participate in our meeting, that would be this is our school in Italy, in the Alps, in the North Italy. The campus there is St. George campus, and a very good meeting. There's two things in July. The basic meeting of all people, as you see. This is a lot of speakers that will be there for all parts of the world. The people for all our world will be there, and you are invited on that. And this the page you can find the mail if you want to contact me also. You can contact by email. This radio transmission, we can do questions and that is first, but if you would like some more information, you can contact us. And if you to participate in our course, they will start in the July, the 27th of July. Registrations are open. This special offer for Middle East. We do a special offer for all Middle East. You go to our pages, you will see that. And will not be another opportunity of that. If you like to participate, we're happy to teach you, to share with you our Mpr in all disciplines. I hope you understand the philosophy of AR. In that short time, in 1 hour, I do the information good for you, and I expect you, everybody, in our courses, and you will see also this presentation later. The Mpr presentation tomorrow will be in YouTube, and you can listen again, and you can re-listen anytime you like the presentation, and you can listen at home. YouTube is very practical. I work for you if you like in our course, in our course in July, and in meeting in various terms, if you like to do that. Have a nice time in your countries. I see there is people all around the world here, and I hope you can participate in our course and our meeting. After the basic course, the PR International School will do the course. The Master for Physio in Osteopathic Manual Therapies is 1 year master, and in dentistry is a master for orthopedics and orthodontics, craniofacial orthopedics and craniofacial orthodontics. I hope you are well. I hope God bless you, everybody. We will be in touch, and our radio transmission now is finished, and we'll see you in the next radio transmission. Remember, all this will be tomorrow in YouTube, and you will see. If you go in Facebook, if you found Mpr in Facebook, you will information there. Okay. Nice, relax. Have a nice day. Enjoy the rest of the day, and we see you in the meeting in various terms if you're in September.